Hello viewers, my name is Olori Giwa. I have here with me Dr. Adewale Adesanya. What does it mean if one skips a monthly cycle, a monthly menstrual cycle? Like for instance, when we were growing up, I know our mothers were always checking the calendar. Have you seen your period today? Have you seen your period this month? Have you seen it? Did you see when was the last time you saw your period? So, what does it mean if one skips a monthly cycle?
Skipping a month. If you note, during my explanation of what menstruation means, I said cycle is unique to individual. So it is very possible for you to miss a month if your length of cycle is more than 30 days. In other words, if you're menstruating towards the end of last month, it's possible for you to miss the following month and your next cycle comes at the beginning of the next month.
Okay.
Do you understand? If anyone has in mind that I must see my period January, February, March, April, May, then that person will tag that as a miss. It's not really a miss. It's because of the length of the cycle, which ranges between 22 and 35 days, starting from the first day of your menstruation.
35 days? I thought we have 31. I mean, the maximum days in a month is 31.
So that's the reason for my explanation.
Right.
So when your period, your length of cycle is still within 22 to 35, it's still acceptable. It's still okay. It doesn't mean there's any problem. So when you count, if you count and your next period, you still have that range of time,
right,
it doesn't mean you have missed a period, or you have missed your month or your cycle. So it could be because of that. And secondly, you can skip months when you have irregular period, because beyond 35 days, then the period is not regular again, because it's gone beyond the reference range for menstrual cycle. Are you getting it?
Okay.
So in that situation, you may need to check why you are having it. There are various conditions that can make you miss your cycle. The commonest one that people talk about, that we might have to talk about some other time, is the polycystic ovarian syndrome.
Okay.
Then there are various, we can't go into that in details right now.
Okay.
There are various things. So in a nutshell, it may mean nothing and it may mean something. But if it's not your usual, and you might need to check to know if it means something or not, rather than assuming.
So you have to check with the doctor.
Yes, you check with your gynecologist.
Okay. So I had a big problem with this particular question. So viewers, I hope we stop patronizing the pregnancy test kits company, because according to Dr. Adesanya, he already explained to us that the normal cycle in a woman should be between, please can you clarify?
2 days and 35 days.
Okay, so if between those days you don't find your period, so to speak, I don't think
you need to go and do
any pregnancy test, or you should be.
Note, if you are a 25 days cycle person and you are waiting till 35, you are getting it wrong.
Right.
So if you have been 35 days cycle person and your mind is set on January, February, March, April, then you notice that in May you did not see period throughout 1st of May till end of May. It doesn't mean there's a problem. So far you are still within your what?
Okay, please, I think we need to just break this one, because I'm also getting very confused, and I'm sure some of our viewers are very confused at the moment. Let me just do it in layman language. Okay, so today is the 20 what? For instance, let's say today is the 2nd.
Okay.
Are you saying I have to see my period the 2nd? So whatever makes me see my period the 2nd of next month, does that mean I am a 30 days monthly cycle person, or I'm a 25 monthly cycle person, or a 30 days? What does it mean? 2nd to 2nd, 1st to 1st, 3rd to 3rd.
It's a simple thing.
Right.
How many days do we have in the month?
Some 30, some 31.
So if you are first to first person, it will be first to first only if you are a 30 days person in a month that is 30 days.
Perfect.
Are you
So
listening?
that's simple.
If you are a 30 days person in a month that is 30, if you are a 30 days person in a month that is 28, you will move to the third of the next month.
Right.
If you are a 28-day person, you should pay attention. Your subsequent period will always be 2 to 3 days short of the previous date. Like for instance, the last one was 10. This one will be like 7 or 8, depending on the length of that month.
The numbers.
So, and it's not so difficult for people to also pay attention from day one. Just count. You don't, first month, second month. By the time you count out first and second, third month, you already know your length of cycle.
Right.
You can now pay attention to understand your system, and it has a lot of advantages. Maybe we'll get there.
That's why I'm very particular about it. That is why I'm very particular about, because
otherwise we'll get there, then we'll talk about it.
Yeah, because if I see my period this month on the 2nd, and I see my period next month on the 2nd, and I see my period the 3rd month, I see my period on the 4th. By 2nd of the 3rd month, I start panicking, like I'm pregnant. I mean, so like you understand?
That takes us back
to why what you said. I'm asking this question.
That takes us back to what you said earlier on. If you are, like I said, if you are 25 days person and you're already counting 30 days, and you said, Dr. Adeson has said on one video that if you are 35 days, you can still wait. Don't get it twisted. Okay, so that's a disclaimer right there. Yes. Check what you did within that 25 days. That is where you can patronize the pregnancy test kit company. Check what you did. Right. If you are innocent, if you didn't do anything, well, don't let me use the word innocent, because if you're a family, if you're a family woman, of course you have right to do so many things. So, but if you are not desirous, that's another topic. That's where the knowledge of this length, ovulation time, and so many other things comes to play. Okay, so that's why we'll get to that. We'll get to that. The safe time to do all these things. Yes, we'll get to that. We'll get to that. When does menstruation stop in a woman? Okay, that's another very good question. Now, there is a topic we discussed some time ago: biological ticking clock of a woman. God created every lady with a certain amount of eggs in the ovary, and those eggs have something to do. That those things we're counting as menstruation cycle. There are things that are happening, and as the day goes by, 1 or 2, 3, 4 eggs are going as you age. So as soon as the eggs are exhausted, I'm using the terminologies that we can all relate with. As soon as the eggs are exhausted, the period stops. That is the natural one. Natural cause. There are various things that can make your period stop. So what you're talking about, period stopping, is menopause. You know when something pause. So menopause. So like in the clinic, most recently, I had a patient who was desirous of pregnancy, yet she stopped menstruating prior to presentation, about 2 years. And she told me she has been advised by several people and all of that, how they can give her some injection, how they can give her some drugs that will bring the period. I just told you the basic truth, which I'm going to say now. Once your period stop and you start counting, and you are no longer within the childbirth reproductive age range, and you start counting and you have counted 1 year, anytime you see blood after, you must run to your doctor, because it's no longer natural. It's no longer normal. That's a red flag. So this period stops when you are menopause, but there are variations. What's the age range of menopause? Is between 45 and 55, average of 51. In other words, some people will get to 55 before they stop. Some will stop at 51. Some will stop at 45. So the same way your cycle, Mrs. A cycle is different from Mrs. B, the same way your age of menopause will differ. But there is a range that is well known. That's 45 to 55.
Okay. Can I be pregnant and still see my period?
Pregnancy is a stage. See, the whole menstruation thing is there is a way that there is a terminology we use that your body is always ready. What menstruation does is you womb respond to the hormonal milieu in your system and prepare the womb in case pregnancy happens. So the moment pregnancy happens, you are not supposed to menstruate again. You are not supposed to see period again. Anything you see after is bleeding, not menstruation.
I hope you can hear that, viewers.
Anything you see after is bleeding. That's no longer menstruation.
That's not natural.
That's no longer menstruation. Once a pregnancy is established, you have fertilization occurring. There are a lot of things that can happen around that. Fertilization occurs. It either come back to the womb and settle down and become baby, or cease on the way, or a lot of things can happen. It either stays where it is and start trying to grow in an abnormal place and cause a lot of troubles. But the most important thing is, once pregnancy is established, fertilization occurs. Anything you see after is no longer period, is bleeding.
And
that is a problem. You must look for why. You must not stop until you know why and stop the problem. Otherwise, it can be very deadly.
Wow.
In some cases, the bleeding happens and it stops. When you check, there are no significant things or happening, then the bleeding stops. You check. It happens in cases where we talk about threatening miscarriage. We have checked. We've seen that the pregnancy has formed. It's inside the womb. The baby is trying to grow, and then the woman bleeds. Then there are things you do, but those blood you are seeing, they are not menstruation.
No menstruation.
That's bleeding, and it can be pathological. If care is not taken, one can lose pregnancy. You can have other complications. You can have other issues. So if you take it for menstruation, you tend to relax that I'm still seeing my period, all is fine, but it's not. So it's always good to check and be sure all is well.
Okay, thanks for the clarification. Okay, so another question is, how does one track the menstrual cycle? I know you talked about paying attention to the numbers of days, that's 22 days menstrual cycle, but how can one track? Because I mean, life is hard for us to be calculating menstruation already. So what's the easiest way, or what's the common way to track one's menstrual cycle so we don't make a mistake? Or
this is one of the simple parts. Remember you said simple yet complicated. This is one of the simple parts.
Right.
You see, there is a common misconception or a general misconception about one figure 14. There's one figure 14.
Never heard.
You've never heard?
Never heard.
There are people who say, okay, 14 days after my period and all of that.
Oh, okay, that.
Okay.
Oh, so, that.
Now, I told you about phases of menstruation. The first phase is 1 to 5. That 1 to 5 too is just, it varies. It can be 1 to 7 to some people. Just like I mentioned, the range of days is 2 to 7. And the phase is 1 to 5 that address menstruation. Now, 6 to 14 is what we call follicular phase. That's the phase where the body prepares the eggs I talked about, trying to release them. So on that day 14 is expected for the egg to be released. Note, that is for a 28-day cycle person, which is the average taken for all ladies. Average. There are some that are 23, 24. It's not the same for them. There are some that are 30, 32, 20, 39, 31, 35. It's not the same for them. So tracking depends on your own length of cycle. The reason why you as an individual needs to pay attention to it, so that you will know the one that is unique,
and so you don't start
to
panicking.
Your system, so that you know when to panic and when not to panic.
Okay.
And you know how to even manage your. So now tracking, now let me give you one constant figure in all of this, is 14 days before your next period. That's the 14 people are always confused here and there. 14 days before your next period. So your ovulation, after your ovulation, you must, okay, don't let me use the word must. You're likely to menstruate 14 days after. So if you are a 35 days person, it means you are likely to ovulate on the 21st day of your cycle, which means starting from the day one that you counting your cycle,
blood flow,
it will be like the 21st day that you will see your. Then count 14 from that time. That's why your period will now come on the 35th or 35th day of your cycle.
Right.
Are you with me?
Yes.
So now, to make this thing simple, why are we stressing ourselves now? Now, there are apps, there are beads, there are some menstrual calendar.
That's what I'm saying. Yeah.
That can guide you. However, also note, there's something we call giggle, garbage in, garbage out. If you still don't understand your system and you don't put the right information, you will still get it wrong.
Right.
You still get it wrong. So your ovulation period is unique to you, and it's based on your knowledge of your system and your menstrual cycle. So I mean, I keep the rest. There is what we call luteal phase. There's what we call the withdrawal phase. You know, when the next one will now be the next menstrual cycle, when you start shedding blood again.
Okay. This particular person was intentional about this question, and I think I have to report back. So I have to pay attention to this.